record. So, Alhamdulillah, we're back. But I would do that class for the answer to yin and yang, which is a part of traditional Chinese medicine, and cupping is an integral part of Chinese traditional medicine too. In as much as when you look at hijama, it belongs to Unani medicine as far as the World Health Organization is concerned, and cupping therapy belongs to traditional Chinese medicine. Each one claims it on a different footing. I believe in India, they're trying to get cupping onto their own Ayurvedic medicine too as a right of ownership. But I'll do a class to answer the yin and yang part of it. It will give a small introduction to traditional Chinese medicine understanding of it. But it basically means hot and cold. In Unani medicine or traditional African medicine, it's also hot and cold in the various languages. In Arabic, Islamic medicine, it's bard wa har, and they see the body in that light, and that is why they treat without looking at the pathogens that cause the various ailments. They don't want to know whether it's a bacteria or a virus or a parasite. As long as they understand the temperament has changed, then automatically they have a cure for what they want to do. We'll go into that, as I said, as we go through. Now I would go back so that we continue our class from where we stopped, and inshallah we will from here go on to finish this module. So we had said on how hijama works. Basically, there are two types of cupping or hijama. It's either wet or dry. With wet, you're taking out dead blood, toxins, and other things that could be there that could, so to speak, be causing a blockage or causing stagnation. While with dry cupping, you're putting your cups, but you're not causing any insertion, so there's no blood out. In as much as you will come to notice with experience and as you go along, that for some people, where you put cups, even on dry cupping, there might be slight blood that comes out. It could be due to the pressure you put, or it could be because there's some reason why it should come out, or you find some milky pus-like liquid or just like sweat coming out from there. There are various things you'll see. We'll go into those details as we proceed on this. So now I want you to notice here, basically I want you to look at the cups. You find there's a pressure, a negative pressure. You can see here and here, if you can see my cursor, there's a kind of bump, a pull of the skin that has moved up because of the suction. Now, if you look on the right side here, you will find out you still see that skin. You can see small beads of blood that are coming from the insertion. But if you look at it, here you have skin. Here you have little blood. So essentially, it's not that the whole cup is full of blood. No. From afar, if you don't take into cognizance the fact that there's a bump, pull inside, you would assume, just like with this cup at the back here, like if you have blood, the whole cup is full of blood, but it is not. It's normally little blood, like you see here, where it has come to the side and like that. So the idea is not to drain your patient's blood, just know that Count Dracula has left town, so there's no need to pull so much blood. The mechanism, like we said, how does hijama work? Like we've always said, hijama is a medical procedure. Hijama is a medical procedure. It is supposed to be performed with the same kind of dedication, devotion, seriousness, composure as if you were going into any operating theater to do any kind of operation. So it's just that it's non-invasive. To a great extent, you just need to just open up the part of the body that needs to. You don't need to see very much of the body either. So you can see your negative pressure is applied. It comes in. When you release your cup, it pulls down. It gives a kind of flow, like how like when you pump in a balloon and you release it. There are details in this that will go further. As we go further in the course, we will talk about how it pulls out blood and co. But there's a mechanism to it. And like we said, it's to correct imbalance of energy at specific points of the disease on the skin. Almost like acupuncture. So you see, they have that relationship. But this brings me back to that answer to I would be giving you of yin and yang, or hot and cold, or bard or har. In some other traditional medicines, they're talking of acidity and alkalinity. Once there's a balance, that the balance of heat and cold is, there's a balance, none is in excess or in depletion, so to speak, then there's no sickness in any organ. So traditional medicines are actually based on that temperamental theory, where you need to bring a balance to the body. Once there's a balance, all ailments go. Whatever the pathogen, it will just go. So their medicine is not based on modern science. Was it a virus? No. Was it a bacteria? Was it it's not based, it's based on that balance thing. So that is why here they're talking about it corrects imbalances in the energy system. It gets rid of waste products, free radicals and other things. These are new names now in their own dialects, and in our various dialects, like we would have some names for it. If we go further and we dig further into our history and we ask those who know, yes, their names. Like I said, if anybody knows what cupping is called locally in your area, please, we would like to know. So we'll add it onto our notes and share that information with a lot of people. And so back to us, yes, Hijama causes excitation of the neurons, releasing, these are all chemicals or hormones or that make things happen in the body, cytokines or chemokines, activating the immune system. It's been known to do that. We'll see some documents that will be shared in future as we go along, scientific documents, research documents that tell you how this is being validated. And it does a lot to the blood vessels, by effect, to key organs at key points where you put it, you put your cup. So it brings out balance where the organ is in sedation or there's excessive cold in it, it tonifies, so it adds heat. Where there's excess of cold or heat, so to speak, excess of heat, it sedates to bring balance, so the organ works as it should. It does a number of things to this big word here that they have, reticuloendothelial system. It, I don't know what it means. I'll check it up and I'll tell you. If anybody knows, it would be great to have it out. I'm sure if Khalid was, Nabil was in class, he would maybe tell us what that word really means. But blood flows through the tissue better. The general immunity of the body is increased. The alertness or efficiency of the organs also increase. It affects the muscles by stimulating expansion of blood muscles. So you find out a lot of athletes now use Hijama cupping therapy to bring their body to par. It beats taking drugs or anything that will make them fail the dope test before any of their competitions. It helps with the lymphatic flow. And the lymphatic system of the body helps clear the brain and makes everything work fine. And it does a lot of things, so to speak. We'll be going into them. These are all just to bring us to par, and we know what we're really going into and the seriousness of it. It goes beyond owning a set of hijama cups and collecting money from people and putting marks on their body. So you see, if we come back here again, if there's incursion of coldness, bardat, which we're talking about, bard wa har in Arabic, in certain parts of the body, or cupping therapy would be used to provide heat, and it's vice versa, thus increasing the blood circulation in the body. These are all just pictures to show you how the cup comes in and what happens, and the skin layer, that's the skin layer there, the barrier. These are the vessels, the veins and the arteries taking blood and bringing blood back, and some debris you find, impurities and little bits of blood toxins that come from various things we eat, various things we drink, some other medications we're on, and that suction breaks the barriers here, and those little things come out. So your veins and your arteries and the skin acts like a strainer. And so at the locality where the cup is, these all gather. So that's why you find sometime when there's a lot of things there, you see the color changes to let you know what is there, and the insertion is made, and those are the little things you want to come out. So according to Unani medicine, that pain on the body or all that is caused by stagnation, bad humor. And stagnation comes from so many things. Sitting too long in one place causes stagnation, which makes the body kind of develop pains, especially in the lumbar area, sometimes on the thighs, sometimes on the feet gets swollen because you're not moving. So there's no motion, blood doesn't circulate, you know. And here in our traditional medicine, you find out when things like that happen, the traditional healer will say, Sanyi ne mishiyawa, there's too much cold in the body. So it's causing that pain, that sluggishness, that where you have cold, it's pain. Where you have heat, it's a kind of, it's not heat, it's a discomfort where you feel like numbness. So once you understand those, you'll be able to know what you need to do as you diagnose your patient and treatment starts. You see, stagnation can be a result of injury, stress, lack of blood supply, or invasion of cold in the body and joints. This cold and body and joints could be excessive use of air conditioners and inappropriate dressing in cold weather and stuff like that. There are a number of things we would look at when we come to treatments, inshallah. So most of these points that we're getting now have been looked at for thousands of years, and those specific points provide warmth and help release the stagnation of blood and body fluids, and ultimately this results in the reduction of pain as an immediate, but it also starts the body from healing itself, which is where the herbal component of treatment comes, because you're now getting the body to use what you have given as building blocks to make the body better. So they relate the principles of Hijama, Bill Shortword, coupled to the principles of governing excretory function of the kidney. So you see somebody is trying to look at it like the same way they feel the kidney filters out all the toxins and tries to keep the body in shape and cool. The act of performing wet cupping hijama clears the blood vessels of that too. So it's like an artificial kidney, and it does a lot of things. Really, you'd appreciate learning hijama, and you'll appreciate practicing it, hijama or cupping therapy, as you choose to call it. It does a lot, and it could, In our clinic, we integrate it into practically every treatment we do. We bring in at least one session of Hijama cupping therapy to bring balance to the body, and we follow it up with the relevant herbs or dry needling or other things we need to do. So you see, this is all part of how Hijama works. There are a lot of theories that cover this, and a lot of work has been done, and it's being done on this. So you see, there's a lot of theories, Bain gate theory for it, genetic theory to it, the meridian system theory, which is part of what traditional Chinese medicine is based on, and cupping therapy. You'd find out that there's that similarity. Like I said at the beginning, we don't know when it exactly started, but we find that there's a lot of similarities to traditional Chinese medicine and Hijama cupping therapy. And in the localities we come from, you find out that more times than not, there are a lot of local practices that our traditional medicine specialists or practitioners or therapists, as you choose to call them, would be practicing that we might really not understand, but knowing about other forms of medicine now, we'll be able to say, okay, this is why they do this, because with the meridian system or the needling system of acupuncture, or the bloodletting system of cupping theory, there's a bloodletting system too in acupuncture. You find them using some sharp objects, sometimes metal, sometimes from trees, like the pine tree that has the sharp, thorny bits. They use that to do some treatments like that, massage too, like that. So you see, the reflex zone theory is there. The nitric oxide theory is that, which is part of the blood cleansing actions of traditional Hijama and cupping therapy. Now, we've come to the end, so to speak, of module 1. However, there will be a small addendum to it, which will be the answer to the yin-yang question, a small addition to make you understand that bit. It will be, I'll go as detailed as I can, so I don't have to repeat it further down, because we would be looking at it further down the line when we come to understanding the medicine and how it really is. We will touch on little bits of that. So remember, for each module, we will be having end of module quiz, which I would write out and I will put in to the group. When you answer these, please send your answers directly to me so that we'll vet it. I would just start on the guidelines for performing Hijama today, and we'll continue with the next class. No, the class after next. The next class, I would look at yin and yang, and it will be part of module 1, but I'll go into this now, except if there is any question you would want me to answer. Otherwise, I'll just take the first point here, guidelines for performing Hijama. Are there any questions? Well, they say when there's silence, it's a sign of affirmation. No questions. So we'll go in with the guidelines for performing Hijama. So, like I said, the whole objective of this healthcare system is to maintain, sorry, there's a typographical error here, we'll edit it, inshallah, is to maintain the normal temperament naturally existing in the body tissues, in the body, the tissues, the organs, and the system, the mind and the soul. Now, the mind and the soul comes in here because Hijama is a holistic system of health. It covers body, mind, and soul. There's this triangle that relates the mind, body, and soul. And where the mind is not in balance, the soul will not be, and the body would not be. Where the soul is not in balance, it affects the body and the mind. And where the body is not in balance, it affects the others too. So you have sayings like the mind is willing, but the body is not, or the body is willing and the mind is not, and stuff like that. But basically in health systems, holistic health systems like Hijama, traditional medicines that we have and go, you find out that when you treat your patient, you have to look at all these parts. Sometimes the patient might not tell, but when you perform Hijama correctly, you will see signs of stress and you'll be able to differentiate if it is physical stress, mental stress, or emotional stress. And from there, you would be able to talk with your patient. If he or she tells you, fine. If he or she doesn't, then you just give general advice based on what it could, your mind could tell you could be the problem and go. But we treat mind, body, and soul. And we will go into this further along the line when we come into treatment. We'll talk about how the mind affects the body, how the soul affects the body, and how the body affects them, and some ailments that are caused directly from the mind, and they manifest after some time on the body. And we find symptoms exist, and all tests from the hospital comes back normal, but the symptoms are still there. So you would understand why. It's not from the village that people have followed him or her. It's just something that the person has kept heavy on the mind and like that. So, like we said, this training and this document you have is for, we see ourselves too as medical practitioners, although the doctors don't see us much like that, out of, I'd like to think, just jealousy. But then you want to know about the mechanism and the scientific basis of Hijama. You want to do it right. Its indications, precautions, and other indications that you need to know. Those without proper training for Hijama cupping should not be encouraged to practice. And those who want to practice should learn well so as not to further disrupt the patient's health condition than when he or she came in. The bottom line is your patient should leave you better than when he or she came in. If he was limping, he should go out walking. If he was bent, crouched, he should go out walking straight. He shouldn't come in walking and have to be taken out on a stretcher. Inshallah, we don't pray for that to happen, but you need to know what to do so that you don't have that kind of problems before you. These guidelines are important, and to keep as a practitioner of Hijama in order to gain the benefits of this treatment without exposing oneself or one's patients to unnecessary harm through that malpractice of not doing the right thing. Hijama itself, we've already said, is a partially invasive medical procedure. It's more importantly a procedure where the skin is pierced and there's subsequent handling of body fluids. Any such procedure in medicine always presents a large potential risk compared to where the skin is not pierced or you don't handle skin. Now, this is more so, we fear more not we fear more, not more of HIV, but more of hepatitis and things like that, because to contact HIV, it's more than just cleaning blood from somebody, but hepatitis could come just from sweat. So you try to protect yourself, and all this information you would get from your patient before you start off. You should have a form which we would give a sample of as we go on to get details from your patient if he or she is HIV or not positive, if he or she has had hepatitis of any of them, A, B, C, or D, or any viral fevers, and co. You'd also need to know other drugs the patient is on, assuming you were treating for diabetes or for high blood pressure or other things. You need to know a lot of other things. That is why it is very, very important, very, very important that at all times hand gloves are used, no matter how close you feel you are to the person, except of course if you were treating your spouse. Yes, but other than that, you have no excuse. I've said your spouse because your spouse is your spouse, and if there's anything that A would get, B would get, so there's no thing. And yes, in traditional medicine, you can treat your spouse. So you find the traditional medicine practitioner treats himself, his wives, his children, his parents, his neighbors, and every other person. That rule in allopathic medicine that you cannot treat your family members and co does not really exist here. You treat everybody except where you feel you're not capable for one reason or the other, then you don't. So it's the other risks that are inherent with hijama is causing excessive loss from your patient. But like we said, when you take history and you know that incorrect piercing or scarring of the body to get blood, a lot of people would discourage the use of razor blades, surgical blades, and shaving blades, and all that. We prefer use of a sharp pointed object like the lancet needles or similar to that which is gotten from that. Then of course you have to know how to dispose all you use, your tissue, cotton, all those things, your hand gloves that you've used, that comes in to that. And basically, as we go on to treatment, this will be expanded too. So there's that need to know. And inshallah, like I said, I'll make a lecture on slight explanation for that yin yang, hot cold part of it, and I'll give you some definitions there too that would come up. I think it's already up somewhere in one of the modules, but inshallah we would come to that, and I'll give you those definitions and go for what a traditional medicine practitioner or hijama practitioner is by definition of the World Health Organization, and what the kind of medicine we do is defined as by them. I pray by the end of this program, we'll all be specialists and you would understand why it is not right to do it without knowledge, and why we try to query those people who just buy a hijama kit and say, I do cupping. And because they get to go online and you can do that search, hijama points for diabetes, hijama points for weight loss, hijama what, and you just put your cups there and you don't understand how it goes. It doesn't work really like that, because you need to know. It's like somebody just becoming a Google doctor and wanting to carry out operations and assuming the 7 years you spent in med school was not worth it, and like that. But inshallah, as we go along, Please make your notes, jot your questions down, and your doubts, your needs for clarification, and go. And inshallah, they will be answered. Bismillah ta'ala, I'll be sending out the questions in the group. I'll try and make them as few as possible, but I would want to see your understanding to that first chapter. And please try to do it immediately as soon as you can and send in, because it will give me a sort of assessment of you, and it'll let me know where we're going and how we're going. And it will not hold us back, because if only 2 people send out of 12 or so people that are in the group, or 3 people, then as we get along, it will slow us down. So let's try to be proactive and try to do all of it together. Let's try and make it right. Inshallah, it will be all right. Sorry, my daughter and I think my grandson are going to lay some complaints. But we've come to the end of today's class as it is. We've finished module 1. The questions will be out except for the addendum and addendum that I'll be putting on, inshallah, in the group. So thank you very much. And we'll look to see you on Wednesday. Sorry, Monday, Tuesday. Yes, on Wednesday we'll have a lecture, and I pray by then the questions would have been answered, so that on Thursday we will be able to, so that on Wednesday we will be able to answer, sorry, on Thursday we'll be able to answer your questions. So thank you very much. This is one of the comforts of working from home and doing live classes. So I wish you a very good evening and restful one. So good night, everybody. Bye-bye.